Okay, we're continuing. This is like part 8 of Prevent and Reverse Atrial Fibrillation in CHF by me, Pete Rogers. If you're following in the book, we're on page 56. We're going to be talking about drug-induced atrial fibrillation. And first of all, I got a quote by Arthur Koestler. He's a guy, well, let's just give you his quote. He lived from 1905 to 1983. He said, "The creative act does not create something out of nothing. It uncovers, selects, reshuffles, combines, synthesizes already existing facts, ideas, faculties, and skills. Some of the greatest discoveries consist mainly in clearing away the psychological roadblocks which obstruct the approach to reality." And that's why, ex post facto, they appear so obvious. Yeah, a lot, because the intelligence comes from the courage to just say, this is true, this is correct. Because there's usually all this peer pressure and big money and all this stuff, coming at you if you don't agree with the status quo. And then I like this quote here by Karl Kraus. He said, "Psychoanalysis is the mental illness which regards itself as a treatment." Yeah, psychoanalysis is totally stupid, all right? But what am I getting at? Why am I giving you those quotes? Because a lot of these drugs that are supposed to be helping the patient are actually causing a side effect that's a major problem for the patient. They're inducing atrial fibrillation, okay? There's a lot of drugs that do that. You're robbing Peter to pay Paul. You take a statin, it'll increase your risk of diabetes. Well, it better lower your cholesterol a lot to be worth increasing your risk of diabetes, okay? So wait till you see how many of these drugs increase the risk of AFib. All right. And this guy, so like I said, the drugs are very often much, much more dangerous than people realize. Okay. And that's why you want to optimize your health as much as you can by diet, exercise, and lifestyle. As much as you can. Some things you can't fix with that stuff, but most things you can. You can certainly improve most things. And I just tell you this because, I've seen many, many thousands of patients. I've been a doctor, gosh, getting on close to 35 years. And I can tell you, I'm 62. The vast majority of patients in their 60s in the United States of America, they're overweight, they're mentally slow, they're sick, not doing well, okay? They're typically hypertensive, diabetic, with coronary artery disease, and a bunch of other problems, abdominal pressure syndrome, cerebral vascular disease. I look at their brain MRI, they've had at least one or more little periventricular flare hyperintensities, which is a fancy way of saying small strokes, okay? Those are the type of strokes where they're just slowing down mentally, but they're not, they're not hemiplegic or anything in their arm or their leg. All right, so anyways, whereas, don't get me wrong, my life could be a lot better, but I'm doing okay. I got divorced last year, but I got a new wonderful girlfriend, 20 years younger than me, who does everything for me. She wouldn't be with me if I was fat, sick, cognitively impaired with diabetes, and coronary artery disease. Okay? So take your pick. Do you want to be, all sick and slow and debilitated, or do you want to be as healthy as you can be? It's worth it. Okay, I sometimes have problems, like I got an old, Achilles tendon injury from when I ran cross country. That'll flare up, and I can't run as much as I want. Okay, I got old eye infection from when I got powder from my gloves in my eye, and that'll sometimes flare up on me. Sometimes I get stressed out and I can't sleep well. Okay, so I have problems, but they're not one of these chronic Western diseases, and I manage mine as best I can depending on the situation. So you're never going to be 18 years old again, but you can still do a heck of a lot better than the average poor chump who's eating a standard American diet or paleo, keto, carnivore, or some other stupidity. Okay, so here's a quote from Bruno Stricker. He's a guy who did one of the very good papers on drug-induced atrial fibrillation. He said, "Almost all drug-induced AFib is from one of the following main mechanisms. Overstimulation, especially adrenergic, like the stress response, increased catecholamines. Direct cardiotoxicity just damages the heart. Changing atrial conduction patterns, that's dangerous. Refractoriness or automaticity in the change of conduction pattern. Coronary vasoconstriction or ischemia, clamping down the coronary arteries, not good. And electrolyte disturbances." Okay, you don't want something like, if you're pissing out your electrolytes, that could drop your potassium in your blood, and that could lead to arrhythmia, for example. So drum roll, please. We'll start going through some of these drug-induced AFib. And the reason you want to know this, especially if you're trying to treat AFib, is sometimes all you got to do is stop a medication and you can get better. Don't ever stop a medication suddenly without talking to your doctor. I'm just alerting you to the drugs that can do this, but you got to work with your doctor to titrate the dose. A lot of medicines, you can't abruptly come off of them. You get sick. You got to gradually come off of them, and sometimes you can't. Okay, but anyways, here it is. Arbutamine, dopamine, dobutamine, dopexamine. These are all just examples, and here's a bunch of references on some of the papers I saw with drugs that are doing these things. Okay, enoxamone, levothyroxine, the thyroid hormone for treatment of hypothyroidism. So basically, you know, if you're hypothyroid, you need to take thyroid hormone. And there's some debate over where you want your thyroid hormones and your TSH to be. I know that standard treatment usually gets things sort of in the middle of the range, but some people think you really want to be higher in the range to optimize your function, but you got to be careful because you go too high on your thyroid hormone dose and you increase the risk of being pushed over into atrial fibrillation. But, you know, it's good to know what the parameters are that you're working with. Okay, levosimendan, milrinone, caffeine. Watch out for caffeine. That can get you in trouble in a hurry because the caffeine can create a vicious cycle whereby it causes insomnia, and then you're not sleeping. That elevates the same hormones, catecholamines and cortisol, and those will increase your risk of being bumped into AFib. You know, cocaine, pseudoephedrine, Sudafed, alpha agonists, albuterol, asthma medicines, some of these other asthma medicines. Careful, even atropine eye drops, nicotine gum, smoking cigarettes, some of these medicines for treating Parkinson's disease like apomorphine. So anyways, I'll leave it at that for today, but just the awareness of things that can do it so you can have more ability to control your own fate and destiny.